You did not pass NCLEX and you're on your journey to retest success. The most important thing you can do is understand what went wrong and fix that so that you can pass on your next attempt. I'm Cheryl Thompson. I'm a nursing professor and I'm founder of NCLEXRx.com. I have spent the last decade working with students like yourself who have not been successful in NCLEX and want to pass on their next attempt. Okay, so you can start by looking at the number of questions that you had on your previous NCLEX before the exam shut off. The number of questions is the same for both the RN and the practical nurse exam, a minimum number of 85, a maximum number of 150. If your test ended with a minimum number of questions, then that suggests to you that you have knowledge gaps, that throughout those 85 questions, you missed passing level questions, you were not able to stay consistently above the passing level, and your exam shut off. The way to address that is to identify the content that you are not have a grasp of and fix that, and use active learning strategies, use handwritten notes, make sure you understand, make sure you're able to apply it to clinical questions, not just memorizing the content. And there are specific approaches to doing that so that you can be successful. If, on the other hand, you didn't pass and you're at the maximum number of questions or closer to the maximum number of questions, that suggests one of three things went wrong. Number one is that you have some knowledge gaps in an area or two of passing level content, and that you were above the passing level and then kept dropping down as the CAT exam delivered those questions in your weak knowledge areas. So if that's the case, you probably have minor knowledge gaps and you need to address those. The second reason for that may be that you had reading errors, that you misread questions, you missed a passing level question because you misread it. The third, and this is what I find most commonly in the clients I work with, is you had trouble staying focused. And because of that, you missed questions that you really did know. And if they were passing level questions, they dropped you down. So the first step is identifying which of those three or how much of those were a factor, and then fixing those. So you don't have to be let behind from becoming a nurse, reaching your dream. You can create your NCLEX success plan. I have outlined in my book, and the title is Overcoming NCLEX Success, a Guide to Retest Success, more detail in chapter 4 about test analysis and specific strategies for addressing each of these issues, whether it be knowledge gaps or focus or attention, even test anxiety, which may be a factor. Your dream is within reach. There's a method that works, and using it, you can be a nurse.